To better understand the downward trend of case numbers, CGTN's Zheng Yibing talked to Ning Yi, a public health expert based in Beijing.
It can be explained in three ways. We all care about vaccines now. Take the US and the UK for example. Both began injections as early as the beginning and middle of December. For those who've received the injections, they are supposed to be protected with immunity after 2 to 3 weeks. Second, during the Thanksgiving and Christmas holidays, there was an increase in travel, family gatherings and parties among friends. In the post-festival season, the close contacts among people decreased and eased the pandemic. And in the US, after taking office, President Joe Biden intensified the preventive control measures. For example, he encourages people to wear masks and avoid close contact. The above measures have directly protected a certain proportion of the population, such as vaccinated people, but also indirectly protected others by cutting potential transmission.
And doubts do exist about the efficiency of the vaccines in light of the coronavirus mutating. What's your take?
Despite recent mutations of coronavirus, the vaccines based on our research and our experience learned from influenza vaccines still have certain effects and play a positive role in relation to viral mutations. But of course, their effect is far lower than that of vaccines of other traditional viruses. We usually believe that if a virus has a higher infection rate, it will have lower virulence. However, from the view of evolution, this is not always so. It might be more infectious and more independent. That means its pathogenicity and fatality rate might increase. So we need to be more vigilant in terms of monitoring, surveillance, having a quick response and developing vaccines.
Besides the social distancing and vaccinating more people, what other measures can be taken to bring this pandemic under control?
I think that it's important to reach a global consensus to control the pandemic, in terms of specific aims, strategies, measures, and collaboration. Last year, we all took actions to control the infectious sources and block transmission routes. This year, we need to have joint forces to quickly develop vaccines and find quick and effective treatment and medicines. This needs coordination across the world. In terms of the current situation, this pandemic poses unprecedented challenges for us. It could take 5 more years for us to go back to normal. But with vaccines and better treatment, I can now see hope and the dawn.